go. Welcome everybody to another episode of The Big Idea. This is Dr. Jeffrey Hanna. And what we're going to be looking at this particular video here is the effect on atlas vertebra realignment in subjects with migraine, an observational pilot study. So what's the point and purpose of The Big Idea? It's what we're going to be doing is we have a look at a little bit of research out there and try to break down some of the technicalities and the complexities into important take-home messages that are useful for two groups of people. Number one, healthcare practitioners who should probably know about this, but arguably more importantly, who's this video done for? It's done for people who are experiencing these kinds of issues, these kinds of symptoms, so that they can understand what some of the different treatment options are that might be able to help them out. Things especially that they've maybe never heard of. And so what are we going to be talking about here? Well, this one is going to be about people who are experiencing migraines. So per the usual, and as we always ask you in the beginning of these, is if you're experiencing migraines, you know somebody like this, make sure you share this video and don't forget to click the like, subscribe button. It helps out the YouTube algorithm so that ultimately this video can be helped to be found by other people who kind of need to know this information. Now, as we're going through and as I'm going through a few things here with the highlighting, do forgive me, my highlighter seemed to do something a little bit bizarre with this particular thing, so there's a few spots where it's maybe off a line or so, but we will do the best that we can. And we will start, as always, with the generalized summary. Here we go. In a migraine case study, headache symptoms significantly decreased with an accompanying increase in intracranial compliance index following atlas vertebrae realignment. This observational pilot study followed 11 neurologists diagnosed migraine subjects to determine if the case findings were repeatable at baseline, week 4, and week 8, following a National Upper Cervical Chiropractic Association intervention. 5 of 11 subjects exhibited an increase in the primary outcome, intracranial compliance. However, mean overall change showed no statistical significance. End of mean changes in migraine-specific outcome assessments, the secondary outcome, did reveal clinically significant improvements in symptoms with a decrease in headache days. The lack of robust increase in compliance may be understood by the logarithmic and dynamic change of intracranial hemodynamic and hydrodynamic flow, allowing individual components comprising compliance to change while overall it did not. Study results suggest that the atlas realignment intervention may be associated with a reduction in migraine frequency and marked improvement in quality of life, yielding significant reduction in headache-related disability as observed in this cohort. And this is the reason why we do these videos for you in the first place, because unless you have the background in this particular type of study and in this type of language, you might be wondering, okay, so is what you're saying, did it actually help with things or didn't it help with things? The short of it is yes, but not necessarily in the ways that the researchers thought that it was going to. And so we'll walk you through a few of the bits and pieces in terms of what does this study actually tell us about the relationship of the atlas vertebra for people who, are experiencing migraines. So, let's start here. Spinal cord distortion. It has been proposed that a misaligned atlas vertebra, so the top vertebra in the neck, creates spinal cord distortion, disrupting neural traffic at brainstem nuclei in the medulla oblongata, encumbering normal physiology. What this means is it means that we have this idea, this concept, that the top vertebra in your neck, which is otherwise known as the C1 or the atlas vertebra, that because it contains certain connections that effectively tether, like a series of suspension cables, that vertebra onto the connective tissue around the spinal cord itself. That if that vertebra is not actually aligned, moving, and in the stable orientation, the way that it is supposed to be when you're normally moving your head and your neck like this, that what it can do is it can impart that tension onto your brainstem, which is only the master control system for everything that goes on in your body. The motor function, the sensory functions, the visceral or your organ functions, all of it happens right there. And so the concept is that if that ain't sitting the way that it's supposed to, it's going to cause problems. You're not going to be as healthy as you otherwise could be. And what these researchers are then doing is they're following what's known as a specific upper cervical chiropractic procedure. And this is very different from what people think of oftentimes in terms of general manipulation, twisting, stretching, cracking the neck. No. Upper cervical is actually a specific division of general chiropractic that's focusing on this area right here. And rather than using those different kinds of maneuvers and methods, what we do as a collective first is we do a series of physical neurological assessments to get just a general sense, okay, is there something in this part of the body that demands investigation because it's having an impact on the body? And so what we typically do is do a series of very, very precise x-rays or specialized advanced scans, sometimes it's called a CBCT, so that way we can visualize the individual components of a person's upper neck and understand which way a vertebra is misaligned, which direction, what degree, and what then is going to be the most appropriate angle that's necessary in order to correct that with the least amount of force possible and without needing to twist, crack, stretch, or pop the neck at all. In fact, most of the time people say, I can't believe how light that procedure was. Well, how can it make such a big difference? It's because this area is very delicate, because the neurology is very sensitive, and as a consequence, you do need to be very precise, because if you're not, you may not actually get it. But when you are precise, you also don't have to use a huge amount of force in order to make these changes. Now, a little bit of the side trivia, but important for the perspective of this particular study. Among the different upper cervical techniques, there are 6 of them that are the most common varieties. In no particular order, they are known as orthospinology, atlas orthogonal, NUCCA, which is what they are using in this particular study. It stands for National Upper Cervical Chiropractic Association. There is also what's called an HIO, or a toggle recoil. There's what's known as a knee-chest style of HIO adjustment, stands for hole-in-one. And then there's also a Blair adjustment, which is the one that I use principally in my own practice. Point is that yes, there are certain differences between all of these procedures, but there's also a lot of similarities in such a way that there are certain things that we can derive general conclusions from the particular studies, or the findings of this particular study. So when you hear me using that word NUCCA, that's what I'm referring to. I'm referring to basically a brand technique method that we do something similar here. So the correction of the atlas vertebra theoretically removes the cord distortion created by that atlas misalignment, aka atlas subluxation, referring to the idea of a misaligned joint. As neurological function is restored, specifically thought to be in the brainstem autonomic nuclei, which affect the craniovascular system that includes cerebrospinal fluid, aka CSF. Now let me scroll down a little bit and then I'll hit a summary. The Intracranial Compliance Index, ICCI in this particular paper, appears to be a more sensitive assessment of changes made in craniospinal biomechanical properties in symptomatic patients than the local hydrodynamic parameters of CSF flow velocities and cord displacement measurements. Whoa, what's going on there? What does this mean? What does this mean? Okay. Specifically now, as we're going to be talking about the creation of migraine symptomatology. There are a lot of different hypotheses and beliefs as it relates to what actually causes migraines in people. And, you know, this covers the full spectrum, whether you choose to call it a cluster migraine, typical migraine, atypical migraine, vestibular migraine, a wide variety. Some of the common underlying issues is that something is causing a disruption or irritation of the sensory processing center of the brain, specifically of the brain stem, that comes in and is processed in this particular area at that level of the C1 vertebra. And it can then cause facial pain, back of the head pain, inside of the skull pain, sinus-like pain. It can also be associated with nausea, which is the real hallmark of, you know, a migraine. It can cause abdominal symptomatology, etc., etc., etc. Something is irritating these sensory nerves in this area. And reality is you can actually have multiple causes. So one of them would be the example of chemical irritation. If you've ever had a hangover, you know exactly what I'm talking about. Chemical irritation giving you the sensation that your head is tearing itself apart from inside out. there's your migraine right then and there. That's one possible cause. Another cause is extreme amounts of stress that overload your system and bring something on. But oftentimes in both of these cases, and in the particular interest as it relates to this article, see, a lot of people are familiar with stress and chemical triggers, be it alcohol, chocolate, caffeine, perfumes, hormones, these different things as it relates to migraines. But these things oftentimes, they are triggers. So the question is, what are they triggering? And the argument is that there is an undiagnosed, or at least very frequently undiagnosed, mechanical issue with the alignment of that atlas vertebra that is pre-sensitizing this area. The question then is, how is that actually occurring? So is it a matter where that atlas misalignment, kind of like if I'm tugging on my shirt, well, let's get it in frame, tugging on my shirt like this, is producing mechanical irritation? That's one hypothesis. Another hypothesis that they're referring to here is that when you have this localized disruption and localized misalignment, that it starts screwing around with the circulation of cerebral spinal fluid and is causing the accumulation of pressure. Not unlike if I was to take my finger like this, give it a little bit of a squeeze, long enough that's going to start going bright red, then blue, and then dead and white and black. So that's another hypothesis. And the other hypothesis is this thing that's called intracranial compliance. Compliance from a nerve, muscle, ligament standpoint, what it's really referring to is flexibility. And this is a very important concept to understand really on a lot of levels, but I want to take it a step back first and give you some useful discussion, useful information that I share with, my own, clients in the practice. And it is that as important as spinal alignment is, as important as nutrition is, that really the single number one most important thing that a person can do throughout the course of their life to get the most bang for their buck when it comes to their health and their well-being, it's physical exercise, movement. I'm not saying you need to go to the gym 5 days a week. I'm not saying that you need to do wind sprints or run, 50 Ks a week. I'm not saying any of that. I'm saying you have to keep your body physically moving, physically active. And that involves two things. Number one is maintaining your muscle strength. And that can be done simply put by walking. Walking engages the full body, really, really good for you. But the other thing is not losing your flexibility. Because as we get older, things have that tendency to start to tighten. And as things start to tighten in our body and we lose some of that flexibility, I mean, look at how flexible little kids are. They can bend their body 3 times over. And I'm not talking about becoming excessively flexible, and we don't need to go that far, but maintaining your overall amounts of flexibility, such as doing yoga, Pilates, general stretching. What it does is it keeps all of those bits and pieces moving as good and well as they can. And this is oftentimes the difference between a person who, say, is 60 years old and is already crippled and bent over in a wheelchair, hardly able to move, versus a person who's well into their 80s or 90s. Yeah, they're still stiff and they're not moving near as quick as they were before, but guess what? They're still getting out there. They're still enjoying life. They are still moving. A good chunk of these people, it's because their flexibility, they never lost it. Or if they did, they were able to reacquire it by being disciplined to do different kinds of stretching activities. So keep your body moving. Now that's at the big scheme. That's at the big picture thing. Now let me break it back down to right here. What they're saying here is that when you look at the area and the tissues around the brain itself, they also should have a certain amount of compliance or flexibility. So they should be capable of stretching and moving like this. But if you're starting to see that those things are hard and they're not necessarily as dynamic as they should be, that as fluid would be pumping and moving, it's going to be hitting more resistance. And the resistance of the tissue can be one of those things, if it's in this upper neck region, ultimately leading to a person to experience migraines, amongst other symptomatology. That is the hypothesis right there in terms of what it means when we see that word compliance. And so having an understanding then of that, it means that a higher compliance score means that there is more flexibility, and lower scores means that there's reduced flexibility, more rigidity, and as a consequence, more susceptibility to injury, aggravation, and so forth and so forth. So, intracranial compliance affects the ability of the central nervous system to accommodate physiological volume fluctuations that occur, thereby avoiding ischemia of underlying neurological structures. A state of high intracranial compliance enables any volume to occur in the intrathecal CNS space without causing an intracranial pressure increase that occurs primarily with arterial inflow. Basically exactly what I said. The more amount of compliance you have, the more it's able to accommodate and to be able to let things move. It's good, it's lovely. And the tighter and the lower it is, it can't accommodate for that. And that then is believed, or at least hypothesized, to be one of the risk factors for why people would be experience migraines. Compliance appears to be functional and dependent on the free egress of blood via these intracranial venous drainage pathways. Why is that important? I'm going to emphasize the word for you here, functional. Functional. As a general rule, there are two kinds of conditions that you can have going on in your body. One of them is pathological. Bleeds, tumors, infections, fractures, dislocations, things that you can see on a scan. Or imagine you're looking at this video on a device. Imagine you've got a crack on your screen. Well, guess what? That's going to affect the way that you can, view this video, and it's going to be obvious there's an issue. Functional disturbances, on the other hand, they are not the same at all. Functional disturbances occur because something's affecting the way that it works. And so you can have a standard MRI or a standard CT scan, a standard X-ray, and the report comes back saying, nope, everything is doing and looks just fine. Well, that's if you're looking for pathology. But like if you have malware on your computer, the computer from the outside might look just fine, but you better believe it's impacting the way that things are working on the inside a whole bunch, and it's going to be disrupting it in a lot of different ways. So this is what we're talking about when we're talking about these kinds of issues. Even if you have been experiencing migraines, had all kinds of different tests, a good chunk of them, I'm willing to bet, are going to be looking for pathology. They are not necessarily assessing for functional disturbances, and that's where this fits in. Head and neck injury could create abnormal function of the spinal venous plexus and may impair spinal venous drainage of blood flow from the brain back to the heart, possibly because of autonomic dysfunction secondary to spinal cord ischemia. This decreases the accommodation of fluid fluctuations within the cranium, creating a state of decreased intracranial compliance. In other words, if you're not able to properly drain blood flow from your head, that's going to cause things to stagnate, and that's one of the reasons why it's believed it's going to be causing this ultimate loss of flexibility. So Demadian and Chu, a couple of researchers, they describe the return of a normal CSF outflow measured at mid-C2, exhibiting a 28.6 reduction of the measured CSF pressure gradient in the patient where the atlas had been optimally realigned. The patient reported freedom of symptoms, vertigo and vomit went recumbent, consistent with the atlas remaining in alignment. So what they're talking about here is they're talking about, and then they mention a few other series of research reports that have been out there, is that there have been case reports and a couple of case studies where people have been experiencing migraines and vertigo and dizziness and a lot of different things associated, closely with migraine, that they get better, after having that atlas specifically and precisely realigned, corrected. And so having that bit of the background, they're thinking, okay, let's see if this is going to be, a little bit more universal. Are these just, one-off case studies? Or is there maybe something a little bit more to it that demands a little bit of investigation? And so what they're proposing, at least as a mechanism, is that if you have lower compliance, so that intracranial compliance, lower scores there, that's going to be associated with migraines. But if you correct that atlas alignment, that the hypothesis is that you're actually going to start to get more flexibility. And as a result of that, you're going to see the migraines actually go down. And how do they decide to study this? They're using something that's going to be called a phase contrast, or PC MRI. So let me show you what that looks like. Okay, so here we have a phase contrast MRI. And I will hit the play button. So a standard MRI just takes the static picture. A phase contrast MRI, and these are two different versions, one using an amplified method and one just using a standard computer. What I want you to see here, and this is pretty cool, is you actually get a sense of motion occurring on the MRI. And in particular, you can see how the brain, especially the one on the right, is moving as the fluid around the brain itself is moving. I'm really going to draw your attention to this area here at that upper part of the spinal cord, the lower part of the brainstem. And so the brain is not a static structure that is just sort of sitting inside of your head doing all of your computer work for you. It's not unlike your heart. It is physically moving. It's pumping. And this is necessary for it to be able to function the way that it should be. And so let's say hypothetically, again, this is the same individual here, but imagine, if you would, that the image on the right is how much movement and flexibility there should be, but instead all the movement that's actually occurring is that on the right, or excuse me, is that on the left. So this is a way then that you can measure to see how much flexibility is there in the tissue, and do you actually see a difference pre and post atlas correction. That's what these researchers actually were looking at. So they used phase contrast MRI, changes in cerebral hemodynamics and hydrodynamic flow, so blood flow and the flow of cerebral spinal fluid. And they were measured at baseline, that is before the patient started care, 72 hours, so that is 3 days, 4 weeks after the atlas intervention, and the same atlas correction procedure used in the hypertension study. So they're doing the exact same thing that was done in a previous study, where they did actually find that there were changes after 72 hours. So here you go as an example. The original score went up initially from a 9 to a 12 up to a 17 after 4 weeks. So remember what we said. The higher the score, the more flexibility there is. Now, this was just a one case study, but that's where all research starts. It starts with one observation, one study that says, wow, that's really interesting. Let's find out then if there's more to it than that. And so in this particular study, they're going to be using the PC-MRI, the primary objective and primary outcome, to measure the intracranial compliance change from the baseline at 4 weeks, from baseline to 4 weeks and 8 weeks by using this specific upper cervical procedure. So what they then do is they go through an intake process and they come to the conclusion that they're going to be having a relatively small sample population, only of 11 people, which as far as research goes is pretty small, but you're going to see why in just a moment, why that was actually necessary. And it was because they needed a very select group of people as part of a pilot or a trial program to see if there was going to be legitimacy to this. And they were going to have these people do a lot of different procedures here. So the first thing that they would do is they were taken to a neurologist who says, yes, you are experiencing migraines. There is not anything else that could possibly be going on to cause this. And so they're trying to make it so that these people are going to be uniform across the board. But they were finding it in both sexes with age ranges from 21 all the way up to 65 years old. So what they had them do was they had them do a series of questionnaires. So migraine-specific quality of life measure, and this one is going to come up a few times here, headache impact test, and then a VAS, so visual analog scale. Visual analog, going in just reverse order of simplicity, it's like a scale of 0 to 10. How are you feeling right now? 0 is no pain whatsoever. 10 is you're on fire being eaten by a shark. You get the idea, something like that. How severe is this? A migraine-specific, migraine-specific and then headache impact test. These are questionnaires to assess and get a sense of how frequently are you experiencing migraines and to what impact are they disrupting your daily life. That is the difference between you have a headache, but you can carry on, you can still function, versus you're having to miss all of your favorite activities with your friends, your family members. You're just staying in bed all the time because you're feeling so dreadful. And so the idea of pain, even though, we have some difficulty measuring it, the easiest way that we can measure it is by seeing how it impacts in our day-to-day. So after they go through the initial process here, they are referred to the NUCCA upper cervical chiropractor. They go through a 3-day process. So day number 1, they're simply doing a bunch of assessments, including a series of pre-adjustment x-rays so that they can see and measure all of the different factors for how these vertebrae have actually misaligned. Day 2, they make the correction and they do a follow-up assessment to see what kind of changes actually occurred. Day 3, they then do a follow-up to see how did you go in that first 24 hours to see is there a need for a further adjustment. They then did follow-up visits once a week for 4 weeks and then once a fortnight for the remainder of the study protocol up to the 8 weeks. So in the very beginning, before they had that initial upper cervical adjustment, they had one PC-MRI, and that was to establish what that baseline tissue compliance was. At week 4, they did it again, and they also had to do that migraine questionnaire and also the headache impact test. And then at the end of the 8 weeks, they did all of that again. So these are people who said, yes, I'm willing to have 3 separate MRIs of my brain and fill out all of these questionnaires and paperwork for research purposes. That's why it's going to be a relatively small group. Good on these people who actually said, yes, I'm looking A, for help with this, but B, if you find any useful stuff here, this is good not just for me, but for other people who are going to be experiencing headaches and migraines. But wait, there's more. At week 8, the neurologists then asked, okay, we're looking for 2 more volunteers who were willing to do this for a further 6 months. And they had at least a couple people raise their hand and say, yep, we can do that. And so they did additional studies, another 16 weeks after the end of the original 8 weeks, going to go through all of those other questionnaires again and having one more PC-MRI. Now, thank goodness, at least to the best of our knowledge, is that MRIs do not produce ionizing radiation. And so, given the choice between having, say, CT after CT after CT, that's going to be an awful lot. You don't want to do that. But MRIs, relatively benign. I think we can also appreciate then that they did not select people if they had a sense of claustrophobia. So they've got then a few different pictures in terms of the assessment protocols that they used to determine, when and where was a person actually requiring an adjustment to their neck. So one of the things that they look at is they look at a relative length of a person's legs when they're lying down. Why would you do that? Well, it's because if your upper neck goes out of alignment, say something like this, it's going to cause your body and all of the muscles to tighten in such a way that when you're lying down, you can get the illusion that one of your legs looks crooked compared to the other side. So a useful clinical outcome measure is you make an adjustment, does that shortness come closer to balance? And if it stays balanced, well, guess what? It means that the change you originally made is still occurring. And that's a sign then that you don't actually need a further adjustment. Really, in the upper cervical world, our ideal target is where we only ever need to do one adjustment that just stays in alignment forever. Now, we live on a planet with time, gravity, and stress. And so, guess what? The probability that it will stay there forever is relatively low, but it does happen, and it doesn't change that's what the target is. Even though you might be throwing darts and aiming the bullseye, even if you don't hit the bullseye every single time, it doesn't change that's what the target is. The fewer adjustments, the less treatment you need in this kind of work, the better. So we would also then use, upright posture measuring devices, because same thing. Not just how is it that the muscle tension is showing up in your legs, but how does it actually show up when we're looking at the structure and alignment of the rest of your body. Posture is not simply a matter of laziness. It's a reflection of what's going on beneath the surface. And where your head goes, so does your body. I oftentimes use the illustration in the example. Question: why does a bull have a ring in its nose? It's because as big as that bull is, and no matter how small you might be relative to it, if you grab hold of that ring, you can guide that bull wherever you need to take it. Where the head goes, the body goes. So this is why we can look and understand posture, whether a person's experiencing migraines, headaches, or even something like mechanical low back pain and sciatica. That upper neck has got to be aligned for things to be able to stabilize as well as possible over a period of time. So here's just a few samples of the x-rays and them illustrating where and how the adjustment is actually performed. You will note that this person is not holding the person's neck twisting and cracking. So the NUCCA intervention involves a manual correction, that is using the hand, yes, of a radiographically measured misalignment. So not just, I'm guessing it's going this way, it's saying it's gone this way. We can pinpoint it. In the anatomical structure between the skull, atlas vertebra, and the cervical spine, that is the rest of the neck. Utilizing biomechanical principles based on a lever system, the doctor develops a strategy for proper subject positioning, practitioner stance, and force vector to correct the atlas misalignment. You see, in doing this and by being as precise as possible, you're giving a customized correction for the individual. And when you do that, you don't need to slam or use a whole bunch of force at all. You just give the right amount there and the body's able to do the rest of the work to be able to release things, take the pressure off. By understanding spinal mechanics, the practitioner's body and hands are aligned to produce an atlas correction along the optimal vector. It is understood that an optimal reduction of the misalignment promotes long-term maintenance and stability of spinal alignment. In other words, when everything is actually sitting the way that it's supposed to be, your body's got a much better opportunity to be functioning and working the way that it should be without having a choke hole or a choke point here affecting how fluid is going to and from your brain. So they then walk through a little bit more of the details in terms of, okay, these were how we looked at all of the MRIs and different things like that. That's for the technician if you want it. And per the always, we'll give you the link for this particular thing here. Now, to the results. What did they find? What did they find? Individually, 5 of the 11 subjects demonstrated an increase in the intracranial compliance, increased flexibility. 3 subjects remained the same, but 3 of them showed a decrease from baseline to end of study measurements. Okay, so 5 got better, 3 did nothing, and 3 actually got worse. Now, they'll hit on this again when we get to the ultimate conclusion, but what it means is it means that that hypothesis that migraines are caused by a loss of flexibility of that intracranial tissue is not actually the case. So they found it in previous reports and found, wow, this is a really interesting association. But on further investigation here, they're finding, oh, interestingly, no. This is most likely not what's actually associated with the cause or the origin of migraines. Now, we need to be very careful here so that we're not drawing undue conclusions. Because what they're saying is they're saying that the mechanism where the atlas can cause this decrease in the intracranial compliance or the flexibility, that's not what's causing migraines, but it doesn't mean that atlas is still not involved in migraines itself. And in fact, the exact rest of the study, what their secondary outcome measures were, they're finding that the atlas is involved in relating to migraines, but it's just not by this mechanism. So what did they found? They found that from people having basically the headache diaries, that during the second month, so after 8 weeks, the headache days decreased by 5.7 days from baseline. At week 8, so excuse me, that would have been 4 months. So, 4 weeks. At week 8, so 2 months, 6 of the 11 subjects had a reduction of greater than 30% in the headache days per month. Mean headache intensity showed no statistically significant change at 4 or 8 weeks, although 4 subjects did exhibit a greater than 20% decrease in headache intensity. The mean headache, shall we say, disability or impact, remember headaches affecting your daily life score, in the beginning was a score of 62. After 4 weeks of NUCCA corrections, mean decrease in scores went all the way down from a 64 down to an 8.9 in week 8. Scores compared to baseline were a decrease by approximately 10. So excuse me, the scores went down basically by about 10 in both cases. So what does this actually mean? What does this mean? It means that the results showed that there really wasn't change in the flexibility or that intracranial compliance. But what they did find is that when they were getting the atlas corrected, that you did have significantly fewer days of actually experiencing headaches and migraines. And it was disrupting people's daily activities less to the tune of about, 15 to 20%. Now, does that mean that everything was perfect? Absolutely not. These people were still experiencing migraines. It's not like flick this, oh my God, I never had another migraine again for the entire rest of my life. Saying no, people still are experiencing migraines, but they're not experiencing it near as frequently, and it's not impacting them. This is helping to increase and improve their overall quality of life. That's a good thing. Certainly, we would love to say, yes, we have discovered the be-all and end-all cure that's going to solve all of these kinds of things, but it's got to start somewhere. And so what the research is saying that, where people are experiencing migraines, maybe not the only piece, but one of the significant pieces that is at least contributing is very likely for many people going to be that atlas vertebra alignment. Now, in fact, somewhere in the detail of this paper, they said that when they were looking at the original subjects, there was actually one individual who they had to exclude because, yes, they were experiencing migraines, but the practitioner said, no, your atlas is actually completely aligned. So this is useful and important to understand, again, especially for people who do experience migraines, is that there is no one-size-fits-all solution. People can experience migraines for a number of different reasons, and usually a combination of those different reasons, where one thing is responsible for 20%, one thing is responsible for 30%, and then something else is responsible for 50%. And those numbers may be different from person to person. So yes, there can be the chemical sensitivities. There can be TMJ or jaw or dental related conditions. There are the upper neck conditions. There can be stress conditions. There can be genetic and epigenetic conditions. There's a whole variety of different things. So we need to have this understanding and appreciation that even though we may not solve everything perfectly, by addressing each piece one at a time and looking to identify the other factors to the best that we can, this is really the way that we're able to help people out the most when they should be experiencing migraines. Now, the most obvious reactions, so adverse reactions to the NUCCA intervention and care reported by 10 of the subjects, 10 out of 11, oh my goodness, was mild neck discomfort, related on an average of 3 out of 10 on a pain assessment. Now, don't misunderstand me. I'm not making light of people experiencing minor neck discomfort. But let's kind of look at this and consider it for a sec. If you've got something that is mucking around with the function of your brain and your brainstem, affecting either nerve or ligament, and you can take that pressure off, and your body then starts to incorporate your muscles in a way that it wasn't able to do before, guess what? That's a good trade. In a large part, it's like going to the gym, giving yourself a heck of a workout, and then, whoa, I am really sore the next day. There's a bad kind of sore, and then there's a good kind of sore. Bad kind of sore is where you're feeling completely trashed and you have a wretched migraine. But if the headache is lifting, but you're feeling sore down through here, good. It's a sign of body adaptation. It's a sign that you're going in the right direction and that you're actually getting stronger. So it's important to note is that even though, ideally, yes, we can again just snap a person's fingers and then boom, problem's all solved, healing's usually a process. And so you need to make best sense of what's going on in a person's body so that you know that you're not going to then accidentally do something that's going to screw things up. Because I've seen this, and I've done this even myself plenty of times. A person's like, Jeff, I'm not having any headaches or migraines, but my shoulder is really sore. Is there something that you can do? And then what we do is we try to offer something then palliative to take the pain away, and they say, oh yeah, my shoulder feels much freer. And guess what? The next day, bang, headache, migraine. Bad trade in that case. And so there can be issues in your lower body which can actually influence what's going on up at the top. So we need to always take these things into account. And even though we're only talking about this relatively one small area of the body, it's a microcosm for understanding what goes on through the entire rest of the body. So in this limited cohort study of 11 migraine subjects, there was no statistically significant change in the intracranial compliance, which was the primary outcome after the NUCCA intervention, but a significant change in the headache quality of life. The secondary outcome did occur. In other words, correcting and adjusting the atlas, it does work. It does help people for migraines. It just doesn't work by this particular mechanism. So guess what? It means we've got more research to do. It means, okay, this might be one of the pieces, but this is not the simple sole explanation, because otherwise that would be really useful. You have a person who's got migraines, have them go do that PC-MRI, and if you see there was not the flexibility, then go check the atlas. It means there are more factors going on. We haven't found that biomarker for it just yet. So it's a good thing that it is expected an effective treatment improves patient perceived pain disability measurements. From the headache diary, a significant decrease in headache days per month was noted even after 4 weeks and essentially doubled. So it just kept getting better and better the longer a person was under care at the end of 2 months. But again, the headache, when people did still experience it, it was pretty much the same. It was just lesser days, lesser disruptions in the day-to-day. And so that's kind of the long explanation of what all of that horrible in-depth summary was at the very beginning, when they're basically saying and taking it all again for the big idea, but then walking you through what the process was here, is that we still don't know the exact mechanism by which people do experience migraines. We know that it's involving the sensitization of the brain stem here, but it doesn't seem to be just related to the tissue flexibility. That might still be a piece of it, but that's not the sole part of it. But what we do know that if a person's got an issue with the alignment of their upper neck, and if they're experiencing migraines, that this is very likely at least one of the major contributing factors towards that. And by getting that properly and specifically corrected, it can go a really long way towards improving a person's overall quality of life. Whew. So we made it mercifully to the end of the video here. Slightly longer than I like to, but you guys, if you've watched any number of these videos, you know we always go on the slightly longer side, because I would much prefer to be a little bit more wordy, but so that you can actually understand the concepts rather than, again, lose some of the details in the research articles here. So if you have enjoyed this video, per the always, what we always do, if you haven't already done so, number one, click the like and subscribe button, because it's going to help the YouTube internet algorithms so that, again, people can find this video who need to be able to find it. On that note, number two, you might know somebody who needs to see this video, be it a friend, family member, experiencing migraines, headaches, things like that. And I understand it too, is if a person has been searching for a long period of time, they've been dealing with things to a certain degree, they've been down so many rabbit holes, they don't want to get their hopes up again. I get it. I'm not going to give anybody unrealistic expectation of benefit. But nevertheless, it is up to them if they want to, have this particular information. If they choose to act on it, good, awesome. We're here to help in any capacity that we can. We don't make any promises or guarantees other than to do our best. And so on that third one, number three, is if yourself watching this video here, or, direct loved one is experiencing headaches, migraines, what do? Well, the first thing I would recommend that you do would be go over to our website, which is atlashealth.com.au. We have links to a ton of articles on a ton of different things, all related to the upper neck. We have a series of videos just like this one here, which is going to give you a lot more information, also a little bit of a sense of our unfortunate personality. We are who we are, and not very funny at that. We try to be, but we're not. So you have an understanding in terms of, what we're looking at, how what we do with the upper neck is different, what we'd be looking at to help, and how it is that we go about doing that. So again, atlashealth.com.au, we're located in North Lakes, Brisbane, Australia. Now, if of course you are watching this video and you're like, oh dear, what am I going to do? I'm nowhere near Brisbane, Australia. Well, what I'd recommend you do is you go to our affiliated, technique organization. You go to blairchiropractic.com. Or what you would do if you're then looking perhaps for somebody specifically, okay, maybe not Blair, I'm looking for somebody to do NUCCA. You would look at the NUCCA organization, or you look at any of the other upper cervical organizations that I mentioned at the beginning part of this video. Because again, even though we're going to be doing things ever so slightly different, we're all of that mindset where we're trying to be as precise as we possibly can so that you can get the best quality of life improvements that you can. So plenty of resources available online. In most places in and around the world, you should be able to find somebody. This is just where we are here. So as we wrap the video here, again, thank you guys all very much for your time and attention. Hope that you found this one not just informative, valuable, but it was also worth your time here and that you have enjoyed it. So this is Dr. Jeff Hanna at The Big Idea. Until next time, take care. Bye-bye.